So I'll jump right in. We're at 2,475 positive confirmed cases. It's been quite a week. So we had plus 64 on Monday, plus 43 Tuesday, plus 38 on Wednesday. Sorry to report, since we last met, we have 5 new deaths. So we've got 93 deaths right now. As that continues to jump, and obviously we would love to go for a week without any jump in or any deaths in the county, and we've yet to achieve that. So that is an aspiration for the future here. So just want to talk a little about the amount of cases in the Latino community. It seems like there's certainly a disproportionate amount. Health is looking into that to try to find out why that is, and that may take more time to do. And clearly, there's a lot of positive cases, and we are looking into that. The number that's just still striking is the amount of folks in our residential care facilities that have passed away, and that's 59 of the 93 now deaths have been from long-term care facilities, which is striking also. On the better news side, we've had only 39 patients currently hospitalized for COVID-19, which is down. We only have 5 of those folks in ICU, which is also down, and that's why you see more of the ICU beds available. We do have good surge capacity and good ventilator capacity. So we continue to monitor those numbers. The positivity rate is down 5.6. We told you that would happen as more testing rolled out. We've surpassed the 44,000 testing ratio. We're doing well in that regard. And testing remains strong around the county with the different sites that we have going on. Looks like, I think Half Moon Bay will be sold out. I think is it tomorrow? The next time Half Moon Bay is up and running, it'll be sold out. I'm losing which day of the week it is. Today's Wednesday. So yeah, so today and tomorrow. So that is good news. Daly City remains strong. We're ramping up in San Mateo, but the swabs may be an issue too, as we hear that that's not where we want them to be as far as availability of swabs. So we continue to try to meet demands and certainly state standards that they put out there. And we've relied on Verily, who's doing a great job of working with us and moving around to various spots. We will look for in the future a spot, hopefully at Tanforan or somewhere in that area, to cater more to the South San Francisco, Millbrae, and San Bruno residents. Though of course they can go to Daly City or any one of these other locations. But really, we found that as we bring these sites to the various areas, more localized area, it's easier for folks to get there, and that is really our goal, to make it available to all those who would who need a test, like a test. As far as the RVs go, we're at we have four clients in our RVs offsite. We've got 12 guests at the Burlingame motel that we are using for step down COVID. That's a lot. I mean, it's more than we've had in a while. We have 8 rooms that are still available, but that's more than 12 we've had. Is more than we've had there in a while. We've got 85 at the Bayfront station, which is for our homeless, vulnerable population, and that, for all practical purposes, is full. We've got 86 others in other hotels, and that leads to about 171 around the county. The Great Plates program, we are happy to report, has been extended, and that has been just a huge success, feeding our hungry senior folks out there and those who have underlying conditions that don't allow them to come out. We've got nearly 1,300 clients that are being served. That program, literally, as of yesterday, we did not know if it was going to continue. We had contingency plans if it didn't. At the 11th hour, it was continued for another month. So we're very grateful to FEMA for picking that up for another month. That's almost 1,300 clients who have somewhat come to rely on that food, was they can't get out and shop and get to the stores and shop for fear of exposure. So it's been one of the incredible success stories that we've had during this COVID-19, where we've reinvested more than $1.1 million back into local businesses, keeping people employed. It has really been and really has been a win-win situation for the restaurants and the employees that work in those restaurants, and then those folks who really are receiving nutritious and delicious meals from all of these vendors. So that is good news. So, I mean, that is really all the information I had to impart upon you. We've got some questions here, so I appreciate the questions being submitted. So we touched a little bit on the Latino community. We're really looking into why that is high and climbing. So I don't know, Sarij, if you have something else to add there, but it's something that we are looking into.
Yeah, I want to appreciate the question, and certainly both nationally and with our colleague jurisdictions, we're seeing inequitable impacts of the disease that align with other social determinants of health, like income, like race and ethnicity, where some populations have borne disproportionate burdens. What the epidemiologists are seeing when they unpack is usually about how much contact do individuals have with other individuals that are not able to be as isolated. And for people who are performing essential work and coming into contact with more people, for people who live in housing situations that are more crowded, there's more exposure. So it is really important to county health that in the ways we approach mitigation, our case and contact investigation approach is anchored in trust from anyone who is COVID positive, that they know that they can trust county health to give them good advice about how to protect themselves and any of their loved ones. We're fortunate to have a diverse, multicultural, Spanish-speaking staff for any Latino clients for whom English is not their first language, that we can engage in that trustful dialogue to give good advice about how to protect oneself or others. We also have been prioritizing in the testing mobilization that County Manager Callagy described, those communities that might have more barriers in getting to a test, and some of the communities we've been in most recently and we've really mobilized increased testing in do have higher proportions of Latino residents. And so in some ways, it's good to see that the testing is reaching the populations that may be at risk. But we certainly take seriously, as Mike said, you know, where we see the spread and how best to assure that especially the most vulnerable populations will be protected from any further spread. And this is something that we and our fellow epidemiologists in the surrounding Bay Area counties are really looking at closely.
And thanks, Sarij. The next one's kind of along the same lines. Well, the case count in Latino community is high. The death count remains low at 13. Why, do you know why? And you know, part of this is, we talked about earlier, you know, 2/3 of these cases are occurring in congregate care. But I don't know, Sarij, if you have more thoughts around this as to why. It's kind of a difficult question as far as the population.
Yeah, well, I'd have to go back and look at all of our numbers. Our epidemiologists are smarter than me, but our Latino population tends to be younger than the average population of the county, whereas other populations skew older. And as many of you know, underlying medical complexity, underlying medical conditions and age have greater risk for fatality from COVID-19. And so I would look at our 93 fatalities and the population, say, over 65 to match those demographics and give us more insight. And I believe our Latino population tends to be younger than our average population, and as it relates to the underlying demographics.
And the next question was along the same lines, is to, you know, really break down the cases by age group and ethnicity. And I think that that's what Sarij was talking about, is trying to unpack some of this information. And really, you know, they only have so much capacity, and they, you know, really are focusing on on many aspects of this disease. So it's really trying to get at the information that's most useful.
And one thing I would just say, I don't know if it's helpful, but in general, most deep study of a disease can occur after there's universal testing and enough experience so that we can really draw strong conclusions. And it seems like we've been contending with this disease for years. It's actually relatively new as diseases go on the horizon of diseases. It appeared, in January, and we're following all we can about the demographics and implications.
Great. And then we're not seeing a huge jump in death counts. There's a reason for that. And I just want to commend health and all they've done in the congregate care living arena. I just want to stress this again. This is not a county responsibility to step in and take care of these facilities. But really, health has done a wonderful job of stepping in and really supplementing staff and providing much needed relief and training to staff along the way. And I honestly believe that in doing so, they have made a tremendous difference in not only the spread of COVID-19 in these congregate care facilities, but in deaths in these facilities. So I think that's what we're seeing. Any death is tragic as it relates to this disease. To me, 5 in a week is a great deal. I'm looking forward to the day where we don't have 1 in a week. But I don't know, Sarita, if you have anything else to add in regard to that.
Well, I just think we also have to stay grateful to every resident of this community that's taking the shelter in place and social distancing and facial covering orders so seriously. We've had great adherence in our community, and we've been able to limit cross contact quite a bit by the actions, and our older adults led the way. They've been sheltered in place the longest. So we're really fortunate that so many residents have sacrificed to, keep the disease at bay. So really grateful.
Great. And then hospitalizations of patients in ICU seem to have had a drop. Any thoughts on that?
Yeah, we watch this daily, and I know this is one of the most important measures the health officer looks at every day. And I don't think I can give you a big conclusion yet, but we're glad. We're happy to see that.
Yep. Okay. And then the last submitted question I have is, can you tell us more about the county moving to phase 3? What specific thresholds need to be met, and where are we on those now? And let me just say before I turn it over to David is that, as you know, we're at the floor of where the governor has allowed us, and we would need a variance to move beyond that. As we talked about before, many counties have done that, but there are requirements set by the state for us to get there. And, we continually evaluate those. Some of the things that Sarita just talked about on hospitalizations are part of the criteria that we look at. There's at least 15 criteria that you have to be met in order to get there. And it's something that we continually evaluate and look at. So we look forward to the day that we can get more open and get more businesses up and running. And we really evaluate that every day. But David, I don't know if you have more information on that.
There's nothing that I could add that would improve on that answer. That's right on.
Okay, so I think Henrietta has a question.
Yes, you've been unmuted.
Yes, thanks so much. I noticed today that in East Palo Alto, there is a call for volunteers to distribute information about the testing. Now, this is just a call for volunteers in East Palo Alto by the city of East Palo Alto. And I'm wondering, is the county using volunteers in any capacity?
Well, I think that relates to our testing, actually, a site down there. East Palo Alto has done a tremendous job of staffing up the Verily site in East Palo Alto and getting information out to folks so they can register and get signed up. They've really staffed the walk-up sites and have done a lot of community outreach. And I've been to that site. It's just so extremely well run that I was just so impressed. But really, I give a lot of credit to East Palo Alto for really bringing on the community-based organizations and really kind of creating this this groundswell of interest in this and getting the word out, because we know that we can't do it alone, that the cities that we're in have the best contacts and the best ways to distribute the information and get the information out, the best pipelines through all the nonprofits that they interact with on a daily basis. So it's just been a great partnership down there. And we look forward to that in every community. And we rely upon that really in every community that we're in when we start these testing. And it'll become even more important as testing goes on.
Sure. Now, do you expect an increase? I understand there's an increase throughout the state in COVID-19 cases. Do you expect any increases because of recent events and protests that have occurred?
Well, I can say that, talking to Dr. Moore about this, that, absolutely, even as we get more open, there will be most surely more cases. We have no idea what the impacts of these rallies and protests will be, and we won't know for probably several weeks. But the good news is that at least most of the people, I was at both rallies, most folks, if not the vast majority of folks, were wearing face coverings. Certainly not keeping with 6 foot distance from each other, but they were wearing face masks. So what impact that has, I have no idea. Sarija, I don't know if you opine on this also.
Yeah, I mean, the main thing I would add to what Mike said is it would take some time for anybody who has been at a gathering, whether it's a peaceful demonstration or any other type of gathering, to know if they are guided by their doctor to get a test and for that to show up in our statistics. We'd expect to look at that 1 to 2 weeks out. And similarly with Memorial Day, you might have heard in other media, there are signs that some gatherings resulted in more cases a couple weeks after Memorial Day. So we're watching it every day.
Okay, thank you.
And Harry, just to your point, it just kind of just want to reemphasize, as we do get more open, it's just going to be so important that we keep in mind that we're still in the midst of a pandemic and that we have to adhere to those precautions that we've been really come accustomed to, of the face coverings, the social distancing, the one way. And I got to tell you, just being out and about anecdotally, that the businesses that I run into are doing it the right way. There's one way in and one way out, and social distancing that's taking place. And I think that will be the new norm for a while if we really want to buffer those exposures and spread them out over time, so our hospitals and health system can really handle them in a meaningful way. The worst situation we could ever get into is we start getting overwhelmed, and that would be very, very problematic. And that's what we've tried to avoid. That's why everybody's paid such a high price to get here. It has saved countless lives, I'm sure. So we just have to keep at it. And as we open, we look for a new norm of where we go about our business in a different way, but we still go about our business.
Next question is in the chat box. Jesse from KTSF. Jesse states, why does county not shut down Millbrae Skilled Care Facility as they are more than 100 residents and staff being confined with COVID-19? Is this facility violating the health order from the county or the state? Thank you.
So just remember, these facilities are regulated by the state, not the county. That would be the state responsibility to shut it down if they deemed it necessary. And apparently they don't deem it necessary. But thank you for that question. Appreciate it.
Next question is Sierra Lopez has her hand raised. You've been unmuted.
Hi, thank you. Earlier, we touched a little bit on hospitalizations and the criteria necessary to move into phase 3. Could you talk a little bit more though about what those hospitalization numbers are, what that criteria is, just like a more concrete kind of example of what that criteria is necessary?
Do you have that specific criteria in front of you regarding the 20 hospitalizations or the percentage of,
I do. I do. I mean, I think that probably, and I can go over it at a very high level, but it's laid out pretty well. If folks want to go to covid19.ca.gov/roadmap-counties, it's all there. But the criteria include. Oh, well, actually, they moved it to the, all right. 1 second. That is still the right website, but they moved the application to a different place. You know, I'm sorry, I don't want to take up people's time. It is there on that page that I just mentioned. It's all there. Okay, here we go. Stable or downtrending hospitalizations. So stable hospitalizations of COVID individuals on a 7-day average of daily percentage change of less than 5%, or no more than 20 COVID hospitalizations on any single day in the past 14 days. Less than 25 cases per 100,000 residents in the past 14 days, or less than 8% testing positive in the past 7 days. Minimum testing volume to test 1.5 per 1,000 residents. Testing availability for at least 75% of residents. There's contract tracing requirements. There's hospital surge requirements. There's skilled nursing facility disease outbreak prevention and containment requirements. There are plans for containment that are required. There's 9 or 10 more different criteria, and they're all there on that website.
And Sierra, just to add to what David offered, thank you, David. Basically, on any given day, we might meet most of the measures, or on some days, even all of the measures. But what the state is looking at in its metrics is what has our trend been either for the last 7 days or the last 14 days. And so as David guided, you know, there's a lot of information on that site, and you could see where we are as a county and where our colleague counties are. In hospitalization, our 14-day average in hospitalization has actually been a little bit down, which has been encouraging, as Mike talked about. But even though we have fewer people hospitalized, it's slightly above the state benchmark. Our positivity rate is below. So there's some complex interplays.
Great. Any other questions? That is it. Wonderful. Thank you all for being with us. Remember, we're just doing these once a week now. So have a great week. We will see you back here next Wednesday. Until then, stay safe and stay healthy. Take care.